Good afternoon, everyone. Thank you so much for joining us on today's webinar. My name is Ashley Mangum, and I prefer she, her pronouns, and I serve as the program manager for pediatric mental health at Marybridge Children's Hospital. And one of the great things that I could do is work with a community collaborative called Kids Mental Health Pierce County. And so if this is your first time joining us on one of our webinars, first, I just want to thank you and welcome you to today's webinar. But if this is your first time joining us, Kids Mental Health Pierce County is a community collaborative that's aimed at streamlining and coordinating behavioral health services for school-age kids here in Pierce County. And so we do a lot of work here in Pierce County about providing educational support and really advocating for youth behavioral health services in Pierce County throughout that care continuum, right? So really thinking about services from prevention all the way through recovery and reintegration. So again, I just want to thank all of you for attending today's webinar. We want this to be a community conversation. We want you to participate as well. So if you could please introduce yourself in the chat, let Dr. Temple know who's here today and introduce yourself to the rest of the community that's here. I think that would be really, really helpful. So just to set the tone for today's webinar, as many of you know, February is Black History Month. The theme for 2022's Black History Month focuses on the importance of Black health and wellness. And so Kids Mental Health Pierce County reached out to Dr. Temple, not only as a trusted community professional, but also as a person from Pierce County with lived experience. I've had the privilege of knowing Ghynecee from all the way back in high school and seeing just the development and growth and just really having the ability to connect with somebody from our community with that experience that can bring her professional expertise back into our community, knowing her experience and all the things that are unique to Pierce County. I thought would make a great conversation. So today's webinar does feature Dr. Ghynecee Temple, who is a licensed psychologist from Tacoma, Washington. Again, this is going to be an interactive presentation with a Q&A session designed to provide participants with an understanding of how racism impacts mental health. And Dr. Temple will also present information on the stigma of mental health care in communities of color and the impact of micro traumas and microaggressions on the mental health and wellness in community of colors. So before we get started, I did want to just go over some community agreements for today. So our goal for today is to create a space in which individuals can express and listen to each other's lived and professional experiences. Through this dialogue, we hope that there is an opportunity where both your experience and someone else's are incorporated into a larger communal narrative. So community agreements help members work together in a way that honors each other, and when inevitable challenges emerge, helps us to return to a sense of an aligned purpose. So for today's community agreements, first we want to recognize. We recognize that we must strive to overcome historical and divisive biases, such as racism, homophobia, transphobia, ableism, and sexism in our society. Acknowledge. We want to acknowledge that we are all systemically taught misinformation about our own groups and about members of other groups. This is true for everyone, regardless of our groups. No blame. We agree not to blame ourselves or others for the misinformation we have learned, but to accept responsibility for not repeating misinformation after we have learned otherwise. Respect. We agree to listen respectfully to each other without interruptions. We acknowledge that we may be at different stages of learning on the content and discussion topics. Individual experience. We agree that no one should be required or expected to speak for their whole race or gender. We can't, even if we wanted to. And trust. Everyone has come to the table to learn, grow, and share. We will trust that people are doing the best they can. We acknowledge once again that we may be at different stages of learning on the topic. And the importance of intent versus impact. We may have the intent not to do harm, but some groups or individuals may be impacted. And some groups may be impacted from us bringing up historical oppressions. So those are our community agreements. And if there are any other community agreements, please add those into the chat as we are navigating today's webinar. So now that we have went through our community agreements and shared a little bit of information about the background in Kids Mental Health Pierce County, it is my absolute pleasure to introduce our speaker today. And I have the absolute pleasure of introducing Dr. Ghynecee Temple. So Dr. Ghynecee Temple is a licensed psychologist who is passionate about helping others thrive and reconnect with their authentic selves. Dr. Temple's research and clinical practices have centered on the well-being of people of the African diaspora. and she believes that caring for our mental health is a path towards healing and liberation. She has been in practice for 8 years, and her clinical interests include women issues, social justice and multiculturalism, eating disorders, body image, group therapy, LGBTQIA+ concerns, career counseling, among other important topics. Dr. Temple utilizes her training as a general psychologist to provide a breadth of services to those she works with. Dr. Temple obtained her bachelor's degree in psychology from Eastern Washington University and her doctorate in counseling psychology from Washington State University. She has worked extensively in higher education and private practice throughout her career and has translated her clinical skills into teaching, consultation, and coaching. So it's my absolute pleasure to turn this over to Dr. Temple. Thank you again.
Yeah, thank you, Ashley, for the wonderful introduction. And hello, everyone. I wish I could see folks' face, but it's okay. So we're going to talk a little bit about, Black mental health. And one of the things I was talking to Ashley about is that I won't just be talking about it in youth, but really thinking about collectively, Black mental health. And I think it's important for us to talk about it collectively because what impacts a parent, caregiver, etc., can also impact, how children are showing up or how they are experiencing mental health distress and crisis. So give me 1 second, and I'm going to share my screen. Okay. And we're going to jump right in. So sorry, I'm getting everything. There we go, going. Okay, anybody having difficulty, seeing the screen? If so, please just drop, a comment in the chat, but we will jump right on in. So a couple of things before we start. I want to give a trigger warning. At some point in the presentation, I'll show a couple of slides regarding demographics or information about suicide in the Black community, but I will give folks a heads up before that slide comes. There's no graphic images or anything like that, but I know that the topic of suicide can be difficult for people. Some may have personal experiences, etc. And so if that does apply to you, please take a moment to step back, turn off your camera, do what you need to do to take care of yourself, but I do want to share that trigger warning. Also, this is a brief time we'll have together, but there will be an exchange of a lot of information and conversation around questions and whatnot. So you can, stay engaged by just checking in with how you're feeling. If you need some movement, if you need some water, if you just need other things to help you stay connected to what's going on right now, please take care of yourself in that way. And then also use the Q&A box, but also you can write down questions as things come up throughout the presentation. Ashley and I will be doing our best to keep track of questions that may pop up throughout. So with that being said, let's talk a little bit about mental health. And I wanted to share this definition from the World Health Organization because I think it's important for us to have some shared language around it. And so when we think of mental health, we think of a state of well-being in which an individual realizes their own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. And really, when we are experiencing positive mental health, it helps us with resilience, it helps us navigate through different life experiences and challenges. And it also helps us to self-actualize. And self-actualizing is the realization or fulfillment of one's talents and potentialities. And so when we think about psychological literature, we talk about the importance for people to have that ability to self-actualize. And so our mental health very much is a driver of that potential. I usually tell people, thinking about therapy, thinking about mental health, your brain is your control center. It controls how you think, it controls your emotions, it controls your actions. And so when those things are misaligned or there are severe impacts on our mental health, it very much changes how we view ourselves, how we view others, and how we interact with the world. And so I just want to share some shared language around mental health and kind of the foundation that I'm leaning into as we talk about it today. So hopping over to the next slide. So I think it's really helpful that we first talk about a couple of key statistics, or at least in my opinion, key statistics regarding Black mental health. And I want to highlight that about the first thing I want to say is that there is a deficit of mental health providers of color, and there is definitely a deficit of Black mental health providers, and that's in the bottom right box. But 3% of 3% of psychologists identify as Black. And 11% of licensed professional counselors identify as Black. And so there is a really great need for these mental health professionals. And this is really important because oftentimes when we're thinking about Black mental health, folks can be really hesitant to try to connect with clinicians that don't look like them. And so if we're already thinking about the deficit in the field, we're already talking about kind of folks being set a little bit back in terms of connecting with providers for care and providers that may share similar cultural experiences or knowledge, et cetera. So although the Black community only makes about 12% of the United States population, we are overrepresented in high-risk populations. And so that means that we are overrepresented in the prison system in terms of homelessness and foster care. So we're 40% of the homeless population, 50% of the prison population, and 45% of children in the foster care system. These structural inequalities have a very severe and negative impact on the mental health of those within these categories. We're also 20% more likely to experience serious mental health problems such as major depression or generalized anxiety. And what often happens is that folks don't engage in help seeking for a number of different reasons. Stigma, lack of resources, lack of knowledge, and these disorders over time can have negative events or consequences, not only for the person, but the people who are in their social spheres. So we really need to think about the harm of lack of diagnoses for folks in this community. But I also want to name that it's important for us to not over pathologize either. And I want to note that, ages 18 to 25 are starting to experience higher rates of mental health problems and lower rates of health service utilization compared to white emerging adults and older Black adults. And so there's not a lot of help seeking going on. And it seems like right now, this 18 to 25-year-old gap or age group, and I would argue a little bit younger, are experiencing acute mental health crises. And this will be important later as I share some different demographics around suicide later. So I'm gonna pop and look in the Q&A. This is a great question. So this information is coming from a couple of places. This is Columbia University Psychiatry. Some of the things are coming from American Psychological Association. In the information that they shared, they did not define if the person was identifying as biracially Black, but I think more so asking how they identify. So if they self-identified as Black, even if they were biracial, they were counted in these numbers. And that was a great question. I appreciate that. Yeah. So just wanted to share with you all kind of a snapshot of some statistics that I think are really important and set the frame for this conversation. So let's talk about factors that impact Black mental health. And this list is not exhaustive. I think this is like my favorite term to say, but there are so many things that impact the well-being of Black folks, especially within our social political context. And so the first thing is racism, but I also put racism and discrimination. I think it's important to recognize that Black people are not monolithic in our identities. So we're not just Black. We can be Black and queer, we can be Black and female, we can be Black and disabled, Black with low socioeconomic status. And so beyond race, we can experience discrimination based upon other identities that we hold, which only works to confound the negative impacts and consequences of such, experiences. And so when we think of racism and discrimination and their impact on Black mental health, there's a lot of, race-based and other identity-based stress that folks can experience. And with these, and honestly could be traumatic experiences, people could experience avoidance, intrusive thoughts, symptoms of depression and anxiety, negative thoughts about self, others, or even the world. And then folks can also internalize negative beliefs about themselves, about their group membership, et cetera. And I also want to name that hypervigilance is increased when we are constantly experiencing discriminatory events. And that means we're very sensitive and reactive, even to stimuli that may not actually be that of discrimination, but those repeated and negative experiences impact the wiring in our brain and impacts how we respond to what is going on around us, because we're in this constant state of protection. And that's actually very emotionally draining. It can be very daunting to have to question if an experience was just based upon, something benign, or if it was truly malicious and harmful and based on race or gender, etc. So I want us to really, and I really wanted to highlight that point first, because I want us to expand past just thinking that racism is the biggest discriminatory experience that Black folks will experience. Another big one is poverty and really lack of access to resources. So poverty is really difficult to work your way out of, especially how our current economic systems are set into place. It can be very easy for people to fall into poverty, but very difficult. And one thing we know about impoverished communities and areas is that there's also a lack of quality resources available. That can include everything from fresh water. If you think about Flint, Michigan, they haven't had water in a long time. That is primarily impacting Black communities. And if you follow the news about that, just talking about not just the physiological, but the emotional toll that these type of events have had on those communities. Not having adequate medical or mental health resources due to poverty works to keep people trapped in the cycle. Poverty is a major sign, or not a major source of significant stress for those across racial lines. And so we really need to think about how poverty gets in the way of us being able to care for ourselves. Another big piece that I want to mention is crime, or vicarious trauma specifically. When we're growing up in environments where there is lots of violence present, it can increase anxiety. So people are always worried, having to keep their head on a swivel, having to be vigilant about what's going on around them. And then it is traumatic. We can experience PTSD symptoms by just watching other people experience violence. So if we're living in high crime areas, thinking about that impact on communities and families, etc. Another piece is stigma. And I think this is a big piece. Across communities, not just Black communities, there are different, I think, beliefs attached to help seeking. Oftentimes I hear folks share that you need to be strong, you shouldn't tell your business outside of the home, you should be able to take care of yourself or else you're weak. And so there is a lot of stigma, I think, even within communities that stops people from help seeking. And part of that stigma comes from, I think, the medical model of care and also historical events that have impacted people's trust and belief in seeking help from professionals. If we think about things like the Tuskegee experiments, where our government was knowingly injecting Black men with syphilis and letting it go untreated for decades. If we think about the field of gynecology and that how enslaved women were used as test subjects without any anesthesia or any post-care. And so there's a lot of cultural mistrust around the medical model of care, especially given the harm that has been done to Black bodies. So we have to navigate both within cultural norms. So especially if we're thinking about folks from the African diaspora, people are coming from different countries. And although, on paper here, they may be Black, there are just other beliefs around help seeking that we have to navigate within our community. And so I think this is really important to name, because I think in recent times, people love to tell people to go to therapy, but we don't talk about the real systemic barriers to even being able to afford therapy, to understand how the process works, because oftentimes people's account of help seeking and therapy is coming from movies or television shows, which don't often accurately depict what the process could look like. And so I think, keeping in mind the different barriers that come up for folks in terms of them wanting to seek help, and the risks and the costs associated with seeking help as well. They could be ostracized from family groups, friend groups, etc. And so really keeping that in mind and having a compassionate lens when thinking about what could be a barrier for folks getting help. And ultimately for folks thinking that their children may need help as well. Thinking about, next, environmental and socio-political factors, I think throughout the pandemic, a lot of people have talked about the social justice, racial unrest, starting with the murder of George Floyd. And I say starting loosely, but I think that's when we had a larger national conversation around the different things that are happening in our communities, in our country, that are negatively impacting the well-being of African Americans. And so we also, when I'm talking about environmental, I'm not just talking about like systems or what's happening in the neighborhood. I'm also talking about folks who live in environments that are unsafe. And when I say that, I'm talking about like access to drinking water, clean drinking water. Many communities of color are positioned next to plants that have harmful chemicals and toxins. Those things impact your body and definitely can impact your brain and your functioning. And so we need to think about, where are these communities situated in terms of like environmental advocacy as well? And so I think that's just something to keep in the back of our minds, that these factors also do impact mental health. And then lastly, acculturation. So, acculturation is the process of social, psychological, and cultural change that stems from the balancing of two cultures while adapting to the prevailing culture of the society. And so you often might hear this being described as code switching. And it's not even just code switching within African American, Black identified folks, but also thinking once again back to the diaspora and people who are coming here from other countries where they are needing to navigate their culture, coming into the American culture, and that can create a lot of, I think, difficulty at times, especially around identity formation and really working through some potential internalized negative beliefs that could come up as we're trying to combine two cultures. And so really wanting to name that, that's something that's actually come up a lot in my work over almost a decade, is like that acculturation or code switching difficulty. So I'm going to take a pause and I'm going to look in the Q&A box. Great. Okay, this is a great question. So someone asked, what are my thoughts about the impact of social media in videos showing police brutality? Do you think that is considered a type of vicarious trauma? Yes, absolutely. So we talked about this glamorization, or I'll start with that, like this glamorization of Black death. I think when we are watching news broadcasts, there's like this fascination with showing Black bodies being harmed or injured. I can remember Michael Brown, like seeing videos and pictures of his body laying in the street for hours. And what that does for a couple of things that can happen from watching these things on social media is that there can be desensitization to the point where Black death becomes so normal that people don't start to have emotional reactions to it, or at least overt emotional reactions, because they're internalizing things, or it's become so commonplace that it's no longer, there's shock and awe value. And then I think for other people, they become so emotional overloaded by these images that it can definitely trigger negative mental health outcomes, depressive symptoms, anxious symptoms, similar to what I was talking about earlier with the race-based and discrimination-based negative consequences. So yes, I often recommend to people to take a step back from social media, the news, etc., just to preserve your own mental well-being and to avoid desensitization, because oftentimes when we're numbing, we're not feeling, we're not connecting. And for those of us who want to be allies or advocates, etc., that's not a healthy way to approach that work. And so those are just like my 2 cents about it, but that was a great question. Thank you. And keep the questions coming as we go along. So thinking about the manifestation of mental health issues, I think oftentimes we think if people have to have like a whole mental breakdown, it has to be this dramatic showing to prove that they are actually in crisis. But mental health, one, can manifest differently from person to person. And sometimes people do a really great job of kind of masking the pain that they're in. So sometimes you really don't know. And so if we are trying to look at changes in behavior, whether it's in our students, whether it's in people in our family, etc., here's just a couple of things to look out for. Social withdrawal is a big one. So if someone was typically very social, outgoing, or at least try to connect with smaller groups of people and they're no longer doing that, that's, I think, a warning sign for you to check in just to see how they're doing. And it doesn't necessarily mean they could be having a severe mental health crisis, but it could mean that something's not aligning right for them. And they may, benefit from having a safe and supportive space to kind of talk through whatever coming up. Irritability is a big one. Oftentimes when people have had kind of long-standing grouchy mood, that's something to look for. Some people can't fully process their emotions. And so anger is one of the most easily accessible emotions that we have. And so it could be really sadness, despair, depression, etc., but it's coming out as anger, irritability. Hopelessness and helplessness, I think, are big ones to pay attention to. So when we think about it, I'm going to mention suicide a bit. When we think about factors that contribute to folks either attempting or completing suicide, hopelessness is a big factor in that. When people feel like they've exhausted all their coping resources, when they feel like, what's the point in trying? That is a big warning sign to really check in with someone, or they feel that they're helpless to make any changes to their situation or to their well-being. Those can signify more serious mental health concerns. Another one is paranoia or hypervigilance. And when I say paranoia, I'm not necessarily talking about the symptoms that would be associated with like schizophrenia or things like that, but I mean more worry that maybe people are out to get them, that they're unsafe, that someone's trying to disrupt their well-being, really checking in with them, or especially around discrimination, thinking about, they may perceive any type of slight between them and another person as a discriminatory experience due to that hypervigilance. So it's really important to kind of keep an eye out for some of these things. Self-destructive behaviors, so that can include self-harm, and also other behaviors like excessive alcohol use, drug use, etc., putting yourself in harmful situations. And then in parentheses, I put behavioral issues, because I think oftentimes mental health concerns can manifest in like acting out by children. They may not have places to process what they're feeling or experiencing. And so, like I said earlier, anger is one of the most easily accessible emotions. And so as a result, they may act out. And so it's not because I don't believe children are bad. That's not a belief that I have. And so really trying to understand what is underlying some of that behavior, some of that acting out behavior. Another big piece to think about is changes in functioning. So sleep, eating, self-care, things of that nature. If you notice that maybe students are sleeping excessively, if you notice that people are overeating or undereating, that's another thing to pay attention to. And then lastly, thinking about depression, anxiety, suicidal ideation, and self-harm. These are obvious signs that there is mental health distress. And so really wanting you to know that, like I said earlier, this list is not exhaustive, but this can be a good place to start in terms of assessing the experiences of those that you're interacting with. And I think when we are checking in with people, some language around that can include like, hey, I've noticed that you've been a little bit more irritable as of late. Is there anything that you'd like to talk about or process with me? And so it doesn't have to be this thing where you should feel embarrassed or shame for talking to people about it. The best policy is just to be very transparent in what you're noticing and reflect that back to the person. And so I'll pause there. And it's a longer question, so give me 1 second. Yeah, I would like to dialogue about this one outside of the webinar, but I'll come back at the Q&A part and I can read this out loud to the group, but I do appreciate this question from Janelle. Thank you. Okay. So I want to now give folks the warning. The next couple slides will be just some graphics about suicidality in Black communities. So I'll give folks a couple seconds before I transition to the next slide. Okay. So the reason why I wanted to highlight suicidality in the Black community is that there has been an upward trend in suicide rates for the Black population. And these statistics are counting the different age groups, so from adolescents to seniors. And so what we've seen is this steady uptick in suicide rates, and this is completed suicide. So this isn't taking into account like attempts. And so the Black population in 2019 was over half the overall US suicide rate of 13.2 per 100,000 people. And so this is something to keep in mind, because some things that have been happening lately, especially thinking about what's been in the news, has been talking about this recent uptick in youth suicide. And really, we're seeing a spike in suicides between ages, I think, like 16 and 25. For those of you who follow like celebrity news, you know, Regina King. If you don't know Regina King, it's Black History Month, so make sure you learn about her because she's amazing. Actress, director, trailblazer, etc. But last month, her son died by suicide, and by many accounts, people did not anticipate it, didn't know it was going to happen. There were very few warning signs to indicate that he was going to die by suicide. And when I was learning more about that story, I started watching more stories of other parents of young Black children who named some of the same things, like bullying led to suicide, and often bullying about their identities. And oftentimes it was around race and or abilities or disability status. And then also noting the impulsive nature is starting to cue us in that like younger folks are not being taught effective coping mechanisms for distress, and therefore may seek to cope with the pain, embarrassment, humiliation, or other negative experiences by dying by suicide. And so this is something to keep in our minds, because the constant uptick and the age group and some of the narratives around that. So if we're thinking about suicide death rates by sex, and this is not counting non-binary folks or trans folks, so I apologize for this.
Ghynecee, it's Ashley. Your screen is zoomed in,
Oh,
so you can only see kind of the title of the slide.
Ooh, okay. How do I zoom out? Okay, wait.
There we go.
Is it back? But it went to.
Yep, you're back in full screen mode.
Sorry, has it been like that for a long time?
Just the last slide in this one, so you're good now.
Is it good now?
Yep.
Okay,
Perfect.
Thank you. And so I apologize for like the lack of diversity in terms of gender identity. But when we're looking at males and females, and this is also comparing to like overall US population, so this is counting other racial demographics as well. As you can see, Black men are definitely at a high and alarming rate of suicide death. And so this is also why having these conversations really are important, because we really need to talk about destigmatizing mental health care. And we'll talk a little bit about Black men's mental health, particularly because of these statistics that are starting to come out around the mental health issues and rates of suicide that like I said earlier, are continuing to be on an upward trend. And so then lastly, looking at this slide, it's talking about suicide rates for Black population by age. And so here we get a better sense of, if you look at the 15 to 24 and 25 to 34, that's mostly where it peaks. The 25 to 34 is where it peaks for suicide or completed suicide rates. And then as folks get older, it starts to decline, where other rates across other racial groups may be steady or rise at different points. And so it's really crucial that we really start thinking about our youth, because around that 15-year-old mark, that's when we're starting to see that sharp uptick in completed suicide. And let me pause to see if there are any new questions. Okay, no. And if there are questions, feel free to drop them in the Q&A. Okay. Okay. So I share that piece, but I think it's also important for us to talk about how to help someone in crisis. I think the very first and most important thing to do is to validate that person's experience and express empathy by using active listening skills. And so active listening skills include verbal and nonverbal behaviors. It can be everything from nodding, giving them, I hear you, to, making sure that you're sitting in an open posture, that you're not distracted when you're interacting with that person, etc. And it's really important to validate a person's experience. It doesn't mean you have to agree with the things that are causing them pain, but if you're trying to de-escalate someone in crisis, telling them that like, no, it'll be okay, you shouldn't worry about that, can be very invalidating to their very real experience. And although you may not experience that, you need to remember this is not about you. This is about you sitting with that person in that moment, recognizing that whatever the issue is, whether you feel like it's important or not, it is very important to that person. And so using those active listening skills, those nonverbal and verbal responses, and validating them can be one of the most important steps in helping to de-escalate the crisis. People just want to be heard. They want to feel that they're not alone. And so sitting with that person in that moment of crisis is very helpful. When you are talking about self-harm or suicidal thoughts, be direct. You don't have to dance around it, because when we do that, what we're doing is adding stigma. One of the ways to destigmatize health seeking is to be very clear and plain and direct about things. And so when I'm working with clients, one is just part of like the standard questions that I ask folks. But if I am in a session and I notice that something's coming up, I'll just ask very conversationally, it sounds like a lot of things are going wrong in your life right now. And you've told me that you've been feeling very helpless. Have you had any thoughts of harming yourself or dying by suicide? And I think people can often appreciate the directness of it because it's not making it feel like a dirty little secret or something to be ashamed about. It's opening the path for dialogue. And I often normalize it, like, when we feel like we've done all we can do to cope and take care of ourselves, of course, like, you see, that seems like your best and last option, but can we maybe work together to get you some additional support so that we can potentially find some other ways to take care of you? So there I am validating, sitting with them, and also being direct and thinking about point 3 with identifying next level of care or resources. You're not expected to, in that moment, save that person or do anything like that. Really, if a student or anyone else is coming to you, just being able to have an idea of resources can be very helpful. But if you feel like there is imminent danger to either that child or someone else or person, I'm not just referring to children in this particular webinar, but call 911. Even in clinical practice, if a person is in danger of them harming themselves or another person, it's law that I have to, share. And that doesn't mean, usually that means with suicide ideation that the person is not agreeing to keep themselves safe. Or they're not agreeing to not harm another person. So it's not just like, oh, you said this thing, let me call 911. It's more about like, are there things we can do to help problem solve? If you're resistant to that, this is our next step. And then lastly, I think as folks who want to be helpful and supportive, you don't have to have all the answers. You don't have to know all the resources. You don't have to be able to have the best responses, even if you just reflect back their experience using the active listening skills and help with getting resources, you've done your job. So don't feel like you're saving anyone. Ultimately, the responsibility and power to save themselves is with that person, but you can be a support along the way. So I think it was just, really important that I touched on that piece of just how to support someone when they're showing up in crisis. And there's a question, so let me pause and we'll talk a little bit about Black men and boys. So the question is, what would your advice to folks that work in the youth justice system, law enforcement, prosecutor, defense, probation, judges / commissioners, etc., be as it relates to criminalizing mental health in our young people? That's a great question. I would challenge folks in the youth justice system to really think about precipitant events, what went on prior to the youth engaging in whatever behaviors that they did, really taking a look at their home life. What does that look like on a day-to-day? What are the resources they have accessible? Did they try to access them? Did they know about them, etc.? Because I don't think we often think as mental health as being impacted by systems, by resources. by parenting, etc. And so when we start to take that deeper dive into their experiences, into their support systems or lack thereof, I think we get a better understanding and can start to empathize with some of their behaviors and understand their behaviors as a function of mental health distress rather than some deficit in their character. And I can, probably answer that a little bit better later, but I think on first brush, like this is what I'm thinking about now, really taking a fuller picture of that person. When I'm doing clinical intakes, we just don't stop with, hey, what's wrong? What makes you want to come to therapy? I'm asking everything about medical history, family, like family structure, who's involved, who's not, past histories of trauma, etc. So I can have that fuller picture so that I'm not pathologizing people as they come into my space. And so I think that same method can be utilized in the youth justice system. So that was a great question. And that's my piece about that. So really thinking about, Black men and boys. And the first thing I put on here was addressing masculine norms. And there's nothing wrong with masculinity. That's not my soapbox. What we have learned, though, through literature and research is that Black men are more likely than white men to endorse aspects of traditional masculine ideology, such as the need to act tough and in control, and to avoid emotional expression. So there have been decades of research on this, and this is problematic for a number of reasons. Black men are navigating systemic traumas, Black death, other things that can be, impacting their mental health, like I shared a few slides ago. So if these are your experiences, and you're modeling for younger Black boys that like, you should never cry, you should not feel, you should be a man and be tough, that's not a healthy coping mechanism. And that can stifle our emotional expression, stifle our ability to go get help. And then I think what we're starting to look at in the literature is that connection between this type of mindset and that sharp uptick in, suicide or self-harm behaviors that we see. And I always tell people the self-harm and whatnot, and especially in Black communities and in Black men, look like drinking every day with the homies, smoking excessively, driving fast, engaging in reckless behaviors that could put them in danger, all because folks are feeling like they cannot find other paths to communicate and express their emotions. And so there's a big push for groups of men of color to get together to talk about masculinity and kind of rework what that looks like. They're like, yes, you can be strong and seek out help. Yes, you can have emotions because that's a natural part of being a human. And here's some healthy ways to express it, or ways to express it that feel congruent for you. So I think that's a real big piece of what we need to start talking about with our young boys and men, about these masculine norms. Where are they learning this from, and how can it be helpful and harmful in certain contexts? We need to understand the impact of structural inequality on mental health. Mental health care is not cheap. I'm a psychologist. It's not cheap to work with me out of pocket. I work at a private practice, and the practice I work for, there are certain types of insurances we don't accept that often folks from lower socioeconomic statuses will utilize. And so we need to think about how those things get in the way of providing adequate mental health care. We need to think about systems of like policing, of the prison industrial complex. We need to think about lack of access to resources, et cetera, and how those things hamper mental health or our ability to have healthy mental health. One that came up, actually, I just added bullet point 3 today, was survivor's guilt. I was actually doing some work with some different clients in some different spaces, and we were talking about this experience of feeling pressure to be the person to make it out, to get out of the bad situation, to be strong, to be the good example. And oftentimes when Black men are put in this position of you need to be the one that makes it out, and they look back and they have friends or family or other important people who are struggling, there is a sense of guilt that comes up. Why am I making it? How come I was able to have these opportunities and not said person? And so that guilt, if not properly processed, can be a real impediment on mental health of Black boys and men. And then lastly, thinking about intersectional identities. Oh, actually, I do want to go back to the structural inequality piece, because I think wanting to name that like Black men have had a unique history in this country, and knowing that their mental health is very intimately tied to factors as like implicit bias of medical providers, high poverty rates, and low access to the services. Like, I just really want to drive that part home. Like there's a big barrier that the structural inequalities face. And especially thinking that a lot of folks who do have mental health concerns end up in the prison industrial complex is another big thing that we need to think about too, when we know like half of the people represented in the justice system are Black, and we don't even make up half of the US population. And so that's a different story for a different day, but wanting to kind of make some of those connections. But lastly, wanting to highlight intersectional identities. Black people, Black men are not monolithic. Black men they hold other identities that could be marginalized. To be Black and gay, what does that mean? For the youth to adults, to be Black and be low SES, or to be Black and actually, struggle with disabilities or other things like that. So we need to think about the impacts of those other identities, in addition to what that means to be a Black man or boy or child navigating the day-to-day. And so wanting just to highlight that there are some unique challenges that Black men and boys face in terms of their own mental health and well-being. And so I'm gonna pop over to this next slide. And I want to talk a little bit about wellness. And I'm kind of going fast because I recognize time. But we need to understand and consider that mental health issues can manifest as a result of inadequacies in other life domains. By addressing needs in one or several domains, we can see an improvement in mental health. There are different facets of our well-being. I think we often just think about food, water, sleep, mental, but really there's a number of things that can impact our wellness. That environmental piece I was talking about, being in stimulating environments that support our well-being. There's the emotional piece, there's financial, there's social, spiritual, occupational, physical, and intellectual. So if this is a new graphic for you, I encourage you to take a moment to take a picture of it, because we need to start thinking of people as whole people. And this is what I was saying earlier, to think about mental health issues, especially in the Black community, beyond race. Race is not the only thing that contributes to mental health, consequences. And so really thinking in your different settings with your contact with youth or other age groups, how are you supporting their wellness, or how are they even supporting their wellness in these other domains? Because if something is going awry in the spiritual domain, that can negatively impact our mental health. If we are having difficulties with finding an occupation to have sustainability and be able to care for our most basic needs, we're going to have mental health problems. And so we need to think about how these things interplay and interact, and impact how we live day to day, because it ultimately can impact our mental well-being. So this is just something I wanted to share with you all quickly. So thinking about culturally responsive care, here's some things that you all can do in your respective roles. I think it's really important to talk about with a person their beliefs about help seeking. What have you been taught? What do you know about it? How do you feel about it? Ask the person what could make the process more comfortable for them. And so whether that's them meeting in your office with you and whatever role that you have, like, how can I make this comfortable? How can we build trust and rapport? When I'm first meeting with clients, this is what I'm talking about. What do you need to feel like you can start to trust me or trust this process? And I recognize, and I always own with the folks I work with, that trust is earned. And so that's always something I lean into, and asking them, how do I earn your trust? Acknowledge the power differentials in the relationship, and discuss how this process can be collaborative. I've learned from my experience that creating collaborative processes where the person feels like they have a say in what's happening in their own care is really empowering and really helps the process. So for example, I talk with my clients all the time about, like, yes, I'm the therapist, I have expertise in the psychological realm, but you're the expert on yourself. And so you bring in your own power, knowledge, and understanding. or even thinking about race, gender, etc. So if I am a white identified, helper working with a young African American person, I need to think about what dynamics that brings into the room and what do I need to share. I've shared this story that I had a supervisor in my early grad school training. He's a white male, and he named and acknowledged, like, hey, I know I'm a white guy in the world. I have more privilege than you, and I'm mindful of that, and I want to make this space feel safe for you. And so these are the things I'm doing to make sure I'm checking my biases and blah, blah, blah. And it was a great conversation that we had, and that acknowledgement made me start to be able to feel like I could build trust with this person. Understand that you're going to make mistakes and demonstrate openness to feedback. We're human. We are going to make missteps, but engaging in culturally responsive care means that you have the humility to recognize that you will misstep, you will apologize for your impact, and not spend time explaining your intention, and then continue to build rapport in that relationship. I think in order to be a culturally responsive caregiver, you really need to know what's going on in the world and how it could be impacting that person. Anything from immigration issues, policing in communities of color, etc. I'm not saying you need to read every single news article, but if you're working with a certain group, it doesn't help to kind of polish up on some prevalent issues. And it doesn't necessarily mean it's going to impact that person, but at least coming back, or at least coming into this space with that knowledge and awareness, can be helpful in creating a trusting and connected relationship so that you can support that person. And so I want to, and this is the last slide, but I want to share like some non-therapy modalities. Like, of course, I'm a clinician and a number of other things by trade, but I don't necessarily think that therapy has to be for everybody. There are ways of healing that don't require a therapy room. Community organizations can be very integral in the health and well-being of Black folks. I grew up going to the Boys and Girls Club. South End Boys and Girls Club was my safe space. That's where I went. And I guess I'm skipping to 3, but like, safe spaces for you. That was my safe space. Having those late nights and other things to go to that were supervised, they were safe. That was great. Community organizations, Tacoma Urban League, other groups like that that are providing resources, providing information, can be very beneficial to helping people heal. Because think about it, I shared that sometimes mental health issues are a result of lack of access to resources. So if we can share a resource with someone where they can get free toiletries or groceries or school supplies, that's you helping the mental well-being of someone in need. And it ultimately, it could be improving the quality of life for a family, a generation, etc. Faith, spirituality-based institutions can be great sources of connection and healing. Different faith-based organizations hold gatherings, meetings that support the mental, emotional, and spiritual well-being of people. Thinking about peer support and modeling adaptive coping. Peer-to-peer, research on peer-to-peer interactions have been great. So if you could start peer groups where other folks are mentoring each other and modeling how to cope with stressors and take care of themselves, that's very beneficial. And then thinking about activities that support healthy racial self-esteem. And so when we're thinking about racial self-esteem, that's how we feel about our membership in a particular group. And so that could be anything from putting on Black History Month programs to doing education throughout the year on the positive contributions of people in the group. So these are ways that we can take care of people and help well-being without being in a therapy room. So I know I threw those last pieces at everybody quickly, but these are ways that you can contact me to follow up if you have more questions. I have an Instagram, a YouTube, and then my email is jenmarie@gmail.com. But I'll pause there. And if there are any questions, please throw them in the Q&A box. I'm gonna stop sharing so I can see them. Yeah, okay, so a question came in that I've heard and experienced the value of dogs, art, and more. Is there research about these? Yes. There is lots of research out there about emotional support animals, the benefits of that. Lots of folks can help provide ESA letters. Art therapy is a great source, especially for kids. I know a few people who do art therapy with children, and it's very restorative. So yeah, you can definitely find research on all of these. And some of these are already modalities of therapy that folks use. But yeah, thank you. And I see the comments rolling in the chat. Thank you all. If there are any other questions, I might have time for like one or two, but then you can always shoot me an email also.
Wow, Ghynecee, this was just absolutely wonderful information and so helpful. And I remember when we met to have a conversation about, what today could look like. We had a great conversation of just the importance of everybody has a role in helping support wellness, right? And that we know every kid and every individual is not going to be able to access that formal mental health system. So just even being able to give some tools and strategies of how we could just be present and listen and acknowledge, and apologize for our impact instead of explaining our intent. It's just so helpful things that I feel like we'll all be able to bring back into our roles and the way that we engage with each other. And so I just really appreciate you presenting that in such a clear and transparent way. And I hope that our community takes this conversations back into their communities and continues these outside of Black History Month, outside of our monthly webinars, but as a way to continue these conversations. I do want to remind everybody that Dr. Temple does do consultations. I know I was getting text messages asking for your contact information about how they can get a hold of you. Are we going to be able to share these slides with participants as well that you shared today?
Yeah, I can just shoot me a reminder. I'd be asking for all the reminders. I can PDF them and then send them your way.
Absolutely. So we'll send that. We also recorded today's webinar as well. So we'll be sharing that on our Kids Mental Health Pierce County website. Again, we try to be very intentional when we plan these webinars and being responsible to things that are happening here in Pierce County and including those resources and supports. So if you have any resource needs, please check out our website. I did put in the chat, kidsmentalhealthpiercecounty.org. Again, I want to thank Dr. Temple for putting together this presentation, sharing this information. It's at a time when we need to have these conversations, and we know that it's going to take all of us to really strengthen and create a real safety net around our kids and families. So I really appreciate your time and expertise, and I want to thank all of our participants for being here today. We will make sure to get these information out to you. And again, if you have any questions, I'd encourage you to check out our website, kidsmentalhealthpiercecounty.org, and also check out Dr. Temple on the social medias that she shared and her contact information as well. So thank you again, and I will end today's webinar. Thank you so much, Dr. Temple.
Yeah, bye.